Hello everyone, I'm Dr. Deepak Thakur, Senior Consultant Pediatric and Fetal Cardiology. Today's video is about congenital heart defects. What are these congenital heart defects? This is a very important topic related to your child's health. So congenital heart defects are the defects which are present in the child right from birth. There are defects in the formation of the heart. The defect can be in any form. It can be either a hole in the heart, a problem with the valve in the heart of your child, or it can be a blockage in any of the vessels which supplies the blood to the body or to the lungs. So there are various type of congenital heart defects, and the severity of these heart defects varies. Right from birth, the child can present with the features of this heart defect, or sometimes these heart defects are missed because they are not that critical, and later on in life we find out that this child is having certain type of congenital heart defects. Now coming to what are the investigation or what are the modalities by which we can come to know that whether my child is having a heart defect or not. The modalities are very simple: an X-ray, ECG and echocardiography. These are the three simple tools which can easily diagnose any kind of heart defect in your child if done by an experienced pediatric cardiologist or a cardiologist who is experienced in evaluating the pediatric heart diseases. So most useful out of these all investigation is an echocardiography. Echocardiography is one of the very fantastic tools that have been developed. It is one of the tools which can easily detect a heart defect without causing any pain or injury to the baby. So echocardiography is just like an ultrasound we do. It is an ultrasound of the heart where a probe is used which is not sharp at all, and a jelly is used over that which is not painful for the child. So there is no needle prick and there is no radiation exposure. These are ultrasounds. These are the sound waves. So there is no X-ray involved, no radiation involved in this. So safest procedure and easiest procedure which is available anywhere on OPD basis. There is no need for admission also for this particular investigation, and this is a fantastic tool which can immediately give you a final report whether your child is having any congenital heart defect or not. Now coming next part, what are the treatment options available if your child has been diagnosed with a case of congenital heart defect? What are the treatment options available for your child? So the treatment depends upon what type of congenital heart defect the child is having. So if I simplify it, so we can simplify it: the child is having a mild type of congenital heart defect, maybe a small hole in the heart, mild blockage in the valve, or mild blockage in one of the vessels of the heart. So these are the kind of heart defect where you just need a medical follow-up or maybe certain medication prescribed by your pediatric cardiologist, and he will advise you the duration of the follow-up for that particular type of heart disease. So usually these heart defects just need regular annually once cardiac follow-up, that's all. Then coming to the moderate type of heart defect, that the child might be having a heart defect. Let's take a simple example. The child is having hole in the heart. The hole in the heart is not small, not very large, but it's of the moderate size. So this is just one of the examples. So what this hole will do, that as the child will grow, as I told you, so slowly what will happen, the heart capacity, because the hole is still present in the heart capacity to match the functionality of the heart will keep on coming down. So these are the moderate heart defects. So these heart defects are usually managed medically, but if on medical management we are unable to get these heart failures or symptoms of heart dilatation under control, we have to go for some sort of treatment for the child. The treatment are either in the form of intervention, that is putting the device inside the heart to close the hole by angiography or angioplasty kind of angiography. So cardiac intervention we call it as, that we usually do in the pediatric age group from one of the big vessels coming from the legs and entering into the heart. We go through that vessel, put a device inside, or if there is a valve blockage, we dilate a balloon and open that, or if there is any stenting required in any particular vessel, we put the stent and just we come out of that. So there is no need of any surgery. And the second option is the surgical cure. Of course, you need an experienced team or an experienced cardiologist who can guide you whether the intervention is safe for your child or not. Anyone would like that the minimally invasive thing should be done on your child so that the child can get a complete cure. But all said and done, Pediatric age group, when we are treating, we usually keep in our mind as a pediatric cardiologist or as pediatric cardiac surgeon that the child is going to have a lifespan of 60 to 70 years. So whatever cure we want to give to the child, that should be one-time cure. So what I mean by that is the complication should be minimum of that procedure, and number two, we should give a 100% cure to the child so that the child can lead a normal life like anyone. So there comes the role of surgery. So if your pediatric cardiology feels that doing an intervention can cause harm to your child, the other option is surgery. Nowadays, with the advanced technology and very well refined surgeons, this thing is very simple nowadays. The risk factor involved in most of the cardiac surgery is less than 2%, or I would say even less than 1% in certain simple heart defect, and very short surgeries are required, and child can usually recover and go back home in a very short span of time. So this is the second option. Then come the third type of heart defect. Third type of heart defects are the critical heart defects, where the child will, mostly the children will be having the symptoms or the sign right from birth or very early in their life. So these are the heart defects which are usually detected by your pediatrician, where the baby is admitted, the NICU team, or any pediatrician where you are going for a follow-up. Usually they detect these kind of heart defect, but yes, of course, being you should be educated about the heart defect, about the symptoms I have talked about. Most important symptoms in any large defect or any critical defect, as I explained earlier, is either the baby is turning very blue, or either the baby is having severe breathing difficulties. These are the two classical signs which can easily tell that this child might be having a very critical heart condition. So treatment options are available for critical heart conditions also. An experienced team can always guide you what type of surgery is required, what type of treatment plan will be there for the child. Most of the critical heart conditions, if I talk about, mostly 90% of the critical heart condition are still type of the heart condition where there is single stage surgery that is required. Around 10% of the heart conditions are there where a multi-stage surgeries are required later on also. But yes, of course, these all children are salvageable. And taking all these things into consideration, my suggestion as a pediatric cardiologist is always there that you keep all the symptoms in your mind. And if you feel your child is having any of these symptoms, do get the child evaluated, because children don't speak about themselves. They will only speak about when they become very critical. Then only you will come to know that the child is having a critical heart condition. But if you keep all these symptoms in your mind, you can get your child evaluated properly and detect all these heart defects right on time and get them cured so the child can have a fruitful life. Thank you so much for watching this video.